Greetings everyone. This is Dr. Megha Goswami, Associate Professor from Mahatma Gandhi Physiotherapy College. Today we will be seeing about the important points on physiotherapy rehabilitation in oncology. As we all know, oncology is an upcoming branch in the physiotherapy with a palliative care. So let's get an overview about this. So let's talk about cancer. So cancer is a disease which is caused when the cells divide and replicate in an surrounding tissues uncontrollably, and most of the time the DNA or the genetics are responsible, and nowadays the lifestyle, it is a very common lifestyle disorders. So what causes cancer? So the common causes of the cancer, as we all know, are the UVR radiations exposure which we get from the sun, or the radio diagnostic people who are more into the MRI and CT scan imaging, who are through the radioactive elements. Tobacco, a very common element in India. Tobacco chewing, cigarette smoking, or BD smoking is very common in villages, leading to the high risk of the oral cancers, and the incidences of the oral cancers are increasing. Besides these, the two viruses like human papilloma and Epstein-Barr virus are also responsible for the cancers. So we can now see that what are the common cancers we can see. So in men, the most common cancers nowadays which can be seen is of the oral cancer, that includes the esophagus, larynx, your oral cavity, nasopharynx, trachea, and in women nowadays, cervix, breast cancer, endometrial cancers, including the thyroid and parathyroid cancers are getting very common nowadays. So let's have an overview that what an oncology rehabilitation can look like. So oncology rehabilitation includes, and it can be subdivided into many treatment protocols according to the individual parameters, like head and neck rehab, breast cancer rehab, vestibular rehab, exercise protocols, pelvic cancer rehabilitation, etc. So here is the picture showing the stages of the physiotherapy, that the physiotherapy can be started from the bedside in an oncology patient, making the patient to the fully functional independence with the active exercises. So let's see what is a rehabilitation in oncology. So according to the physiotherapy prospectus, we will see that the oncology rehabilitation includes enhancing the quality of life. What is oncology rehabilitation? What are the goals, and what is the importance of the rehabilitation in this oncology care? So first, let's talk about the introduction to the oncology rehabilitation. So oncology rehabilitation, you can say in a common language, a cancer rehabilitation program, which includes a holistic approach, including the most important part of the rehabilitation are the oncologists, and whole palliative care, which includes psychologist, nursing staff, and to deal with the cognitive impairments caused by the cancer. So oncology rehabilitations are also designed according to the individual needs, and with the coordination of the patient, family, and the other staff members. So what are the goals of the oncology rehabilitation? So first goal, the first foremost important, is the improvement of the quality of the life, to increase the independence, that is to achieve the maximum functional independence of a patient, reducing the side effects of the treatment like chemotherapy, and the post-surgical complications, and the most important is managing the pain. So the common functional impairment what we can see in the oncology patients are pain, fatigue, and muscle weakness. So definitely a long-term immobilization, hospitalization with excessive chemotherapy and the medications definitely lead to the fatigue and muscle weakness, which can be improved with the physiotherapy rehabilitation, regular exercise protocols. Range of motion limitations, definitely the common conditions like breast cancers, oral mucosa cancers, these conditions also leads to the limitations in the neck movements, scapular movement, shoulder movements, and the stiffness in the shoulder. So very important part in which the physiotherapy plays a major role to improve the range of the motion and to improve the functional independence. Lymphedema, again in the breast cancer, the most common condition which can be seen, but it can be managed easily with the help of physiotherapy treatment. So the psychological support in this oncology rehabilitation also plays a very vital role, as the collaboration of the psychologists, healthcare workers, and also is helpful to promote the mental well-being of the patients. So now let's see about the physiotherapy assessment in oncology. So this physiotherapy assessment in oncology first is a comprehensive assessment approach. That means each individual patient needs its own assessment chart according to the condition, like it could be a buccal mucosa post-operative case, a breast cancer, a thyroid cancer, or a stomach cancer patient, leading a functional evaluation in detailing, which may include your functions, your restorative range of motions, and your functional independence, for which many scales can be used. So considering all these, the most important is the assessment treatment related side effects, which should be told to the patient before the preoperatively and postoperative for the home exercise care program. Also, with this you should have an individualized care program for the patients. So the treatment which can be considered in the oncology rehabilitation includes exercise therapy. That means you can go for the manual therapies. You can go for the passive range of the motions, assisted motion as the patient's condition permits. Manual therapy. So manual therapy includes your could be the reducing the joint stiffness or the shoulder stiffness or the knee stiffness, which can be due to the long immobility, or it could be due to the underlying osteoarthritis or arthritic conditions. Neuromuscular re-education or some of the PNF techniques, which is very helpful, especially in the oral cancer patients, for the facial cancer, for the opening of the mouth, and it may be also very helpful in the patients in the oral cancer who most of the time get problem after the post-operative cases, that they have a problem in swallowing and opening the mouth and in the verbal speech. Lymphedema is again a major complication, as we have already seen in the breast cancer patients. So with the crepe bandage techniques, with the proper massage techniques and proper positioning, the lymphedema and can be reduced in such cases. So patients' education and self-care management is as well important, which can be given to the patient through the home exercise program. So survivorship and the long-term rehabilitation needs is a very important part of the oncology rehabilitation, explaining the patient the long-term support which he can get from the rehabilitation, and which may include the advancement technologies or the advancement in the palliative care and the opportunities for the rehabilitation outcomes. So the principles of the oncology physiotherapy, the first one is the individualized care. So, recognizing the patient's individual needs and making a protocol according to him is very important. Multidisciplinary approach, as we have already discussed this point also. Healthcare professionals, including the oncologists, psychologists, nursing staff, each and everyone who is doing good care of the patient. So, this multidisciplinary approach is important in oncology rehabilitation. So, evidence-based practice, that means research work is very important. It should be a grounded evidence practice for any of the treatment protocols to be followed for such patients. Assessment and monitoring. So the oncology also post-surgical and pre-surgical both. The assessment and monitoring is important, especially working on the motor functions, on the range of motion, on the fatigability of the patient, so that the patient can improve post-surgically as well. Symptom management. So basically, patient can be managed symptomatically, like for pain, for limitation, for stiffness, and for increasing the functional independence. Like as early as possible, the ambulation should be initiated for the patients in oncology. Exercise prescription. So the patient, after being discharged from the hospital, requires a long-term rehabilitative care. For that, the patient can be given individualized, personalized home exercise care program through the exercise prescription, including the exercises which can be performed on a very minimal basis at home. Supportive care, so emotional support and psychological support for the mental well-being of the patient is very important, and with that the psychologist can work as well as the healthcare workers, and very important is the counseling of the family members whose constant support is needed for the patient. Survivorship and long-term care, again a very important point, as we have already discussed in this, that the rehabilitation program for the home exercise and the rehabilitation program post-surgical is very important for the patients. Continuity for the care. follow-up after the post-surgical cases, follow-up of the exercises are very important to achieve the maximum functional independence for the patient. So according to these principles, the physiotherapy plays a very vital role in improving the physical function, the quality of the life, and the well-being of the patient affected with the cancer. Thank you.